Can you speak to that culture of high function depression within training and within healthcare systems from your experience?
Sure. I think in general, the term burnout is overused in medicine, in the medical field, amongst doctors, nurses, other healthcare providers. And I think the word depression is underutilized in this field. I think so many of us, myself included, when I first really started experiencing symptoms of depression, would tell myself, this is burnout. This is just burnout. Because burnout is a more socially acceptable term. You know, we all have been burned out in some capacity, whether it's burnout from, caregiver burnout from having, kids running around the house and you can't focus on, the thing right in front of you. I don't have kids, by the way, yet, so I'm speaking theoretically and hypothetically. But for people that do have kids, I've heard that burnout is quite common. And burnout within the field. So burnout seeing patients and all of the stressors that come with not seeing patients, all of the notes, all of the prior authorizations, the insurance issues, the limited amount of time that you have with patients. So burnout has become such a common word, and burnout is real and burnout happens. But I think we are overutilizing it and continuing to work and just saying, I'll get better on my vacation. Once I get a break, then I'll feel better. But with depression, the break isn't enough. The vacation isn't enough. One way that I knew that I was depressed was that week vacation didn't bring me back. I was still experiencing, you mentioned anhedonia, the inability to experience joy and happiness. I was experiencing that to the point where I remember being out at a restaurant with friends. It was supposed to be a joyous occasion, and I felt nothing. And that's not super common with burnout. There's a lot of overlap, as you well know, between burnout and depression. But there are some things that are, okay, now it's getting to be a point where it's a little more than burnout. So to answer your question, I think we need to do a better job of differentiating what is burnout and what is depression, and how do I know when I've crossed that sort of barrier. And number two, just being more open and accepting with saying I have experienced depression, or even more vulnerable, I am experiencing depression as we speak.